Understanding systolic and diastolic blood pressure. What is systolic blood pressure? When the heart is actively beating, it is pushing blood out into the arteries. Doctors call this systole, and that's why it's called the systolic blood pressure. It's the high point of pressure read during active heart muscle contractions. When the reading is 120 millimeters of mercury or a little below, and a person is sitting quietly at rest, the systolic blood pressure is normal. High systolic blood pressure. The squeezing force of heart muscle rises as it pushes out blood when a person is exercising, under stress, or at similar times when the heart needs to beat more than it does at rest. The systolic pressure goes up with it. In these cases, the heart stress is normal and so is the blood pressure. That's why it is so important to take your blood pressure during periods of quiet rest before diagnosing hypertension, or high blood pressure. Low systolic blood pressure. If the systolic blood pressure is lower than normal, it's called hypotension. If this low blood pressure is serious enough, it can cause lightheadedness, dizziness, or fainting. If it lasts long enough and it isn't treated, it may cause organs like your kidneys to start shutting down. Systolic hypotension can occur if the amount of blood becomes too low. This can happen if you are severely dehydrated or an accident causes major bleeding. There just isn't enough to push through the body. It also may happen if the heart muscle is too weak to eject blood normally, as in cases of cardiomyopathy, or if the artery walls dilate and become too wide, as in vasovagal syncope. Sometimes this low blood pressure happens when you change positions suddenly. You may feel dizzy when you stand up because the heart is pumping blood against gravity, which pulls it down to your feet. This is a common condition called orthostatic hypotension. What is diastolic blood pressure? The heart has 4 hollow spaces, and it takes tiny rests between beats so that blood can refill them. Doctors call this pause between beats diastole. Your diastolic blood pressure is the number that was read during this pause before the next heartbeat. A normal diastolic blood pressure during quiet rest is 80 millimeters of mercury or a little below 1. If you have high blood pressure, the diastolic number is often higher even during quiet rest. Low diastolic pressure may be seen with dehydration or with severe bleeding. It also may happen if the artery openings become dilated and widen. Quiet rest for accuracy. The level of your blood pressure depends on the activity of your heart and the stretch in your arteries. As we have seen, blood pressure changes from moment to moment as the heart beats. In addition, your systolic and diastolic pressures, the highest and lowest points of your heartbeat, change depending on your activity level, stress, fluid intake, and other factors. This means that it is better to limit how these other factors change your pressure when taking a blood pressure reading. For the most accurate reading, it should be taken in a calm, warm space after you rest quietly for at least 5 minutes. Measuring blood pressure this way is a challenge in a busy doctor's office, and makes it harder to assess for high blood pressure. Many experts suggest recording blood pressures over an extended period of time, or adding other techniques before diagnosing high blood pressure. Summary. Your blood pressure is a report of the systolic and diastolic numbers as your heart works. These values are important in diagnosing and managing high blood pressure. They're also important numbers used when treating people for a range of conditions, including heat-related illnesses or severe blood loss. It's best to get an accurate reading under calm, quiet conditions. If you have any questions, please comment below. Thanks for watching.